Hello, and welcome to Insight into Wellness. My name is Alexandra. Thank you for watching and listening. Today, my guest is Kevi Keenom. She is a good friend as well as a licensed acupuncturist. As a board-certified medical Chinese herbalist, Kevi incorporates herbal formulas in addition to her acupuncture. She specializes in electrostimulation acupuncture, massage, and gentle styles appropriate for treating children, which is what we're going to be talking about later on. Kevi is also the owner of Wildfire Family Clinic here in Portland, Oregon, and has been practicing locally since 2012. Kevi, thank you for joining me.
Thanks for having me, Alexandra.
Yeah. I think what's so important and why I started these interviews is, I really think expanding on what holistic health is so important, and helping and giving tools and techniques also so important. But one thing I think that is missed out is shining light on the practitioners behind the scene, working and really studying and giving their lives not only to the practice themselves, but to learning to help others. And so as we start off the interview, I would really love to hear about you and your journey, and really what brought you to this point, and maybe if there was a starting point in your life that kind of jump-started you into this wonderful world.
Yeah, so my short answer when people usually ask me what got me into Chinese medicine has to do with growing up in Hawaii and the huge influence of the Asian population on the culture there. I like to tell people I'm a product of my environment, and I think I was actually about 24 when I was working across the street from the World Medicine Institute, which is now closed, but it was in Hawaii in the Manoa Valley, close to the University of Hawaii. And sometimes on their lunch break and whatnot, some of the students would come across the street for a beer and chat with me about what they were learning. And so that was kind of when the seed got planted about studying this amazing body of medicine that eventually would become my career. There were earlier things that happened as well. My mom used to receive shiatsu, and then when I was 11, she started to give me some shiatsu massage, and so that was kind of like the thing that turned on my mind that I wanted to also learn about it. And then I can remember being in my 20s when I started to just grow this huge distaste for, and gosh, this is always gonna polarize anybody who feels this way or doesn't, of course, but for what was happening in Western medicine, especially with HIV patients. I remember reading about this story, especially in the newspaper, where 350 homosexual men in the Bay Area, this is around the time when Dr. Kevorkian was kind of big in the news, the doctor that was euthanizing his patients. Of course, they were usually toward the end of their life and such, but this particular doctor in the Bay Area had helped 350 homosexual men that were given an HIV diagnosis to basically commit suicide. And I felt like that was just a travesty and completely wrong. And I thought, what are we psychically telling people? What is the message that we're imparting on people's mental state when we give them a diagnosis? And how deep does that reach into the decisions that we make? And is there another way? So these questions started to percolate in my mind, and having so much distaste for what was happening in the mainstream medicine, my brain decided I can't just be somebody who's a naysayer. I have to also have some type of a alternative to share with people. Now, of course, when I hear people calling Chinese medicine alternative medicine, having come this far down my path and now studying for my doctorate in Chinese medicine, I cringe a little when I hear people use the term alternative medicine, because yes, in the US, it is an alternative to the Western paradigm. However, it's just still medicine, and it's just Chinese medicine. So the fact that we've kind of created this new thing in the West where it's a little bit on the woo-woo side. That doesn't really exist in the Chinese model. Of course, I think that it's fantastic that we're creating new ways to use Chinese medicine. Yet at the same time, a lot of the alternative implications kind of come from this very westernized culture. So
Yeah.
I'm not really there in my head anymore.
And so, you decided to open your own clinic, and you've also traveled to China to learn. You are immersed in, like you said, not only the medicine, but the culture. And how has that played a role in your life?
Well, as you know, I met my husband in Chinese medicine school, and we bonded over our mutual bad Mandarin skills. We had both been in China in the year 2006 studying Mandarin. He was in a different school than I was, so our paths did not cross at that time. And then, of course, we're hoping our daughter gets to go to the immersion school and will learn Mandarin and become an acupuncturist, but of course we'll never tell her that. We'll just see what happens. So
Yeah.
it's influenced everything, Alexandra.
Yeah. And, just to think about coming from myself and the few years that I've been studying Ayurveda, and the lengthy amount of time that you've been studying Chinese medicine, and not only studying but practicing, we can't unknow things. We learn something about our health, we learn ways that are going to benefit us and things that we can do for ourselves. But we also are humans, and we also live a life of free will. And I want to know, for you, how have you balanced knowing the things that are going to make you feel better and push you to be your best, highest self, and also being a real person, being a mom, owning a business, and going back to school? How is that for you, and how has it been for you?
Yeah, that's a great question. If I didn't have real life history and a real background and have my own scars and memories and hurts and pains, I wouldn't be able to relate to any of my patients. Similarly, if I hadn't gone through my own health challenges over the years, none of the information that I would have learned would have stuck in my brain. If I didn't know people in my life that were suffering from things that I was learning, there would have been no application for me to want to actually continue to remember it. So when I'm when I'm thinking about how do I balance all these different areas of life, and how do I go on with that knowledge of that there's a way to do things, and then we're all human and we all kind of fall short. I do have enough of this like Virgoan part of my brain that likes things to stay in balance, and really strives for some sort of I can't use the word perfection, that's not really in my vocabulary, but I desire the best for myself and for my family and my friends. Yet when you have lived in the real world your whole entire life, there's forgiveness, grace, all those things that you would give to your best friend, you need to learn to give to yourself. And that's what I've learned over time. When I fall short, when things don't go right, I have to just treat myself like I would treat any patient that comes through my door, with love, acceptance, forgiveness.
Yeah.
Yeah.
I think that's the basis of all healthcare, is first self-care and self-love, and finding that, and then from there stepping into physical applications of care. So one big reason why I'm so excited to talk to you and really touch to my client base is parents. We have children, and children can receive acupuncture as well. And I don't want to butcher the word, so I'm going to let you say it all. And I'm hoping now that we can kind of dive in. And thank you so much for sharing your history. And I love to hear more details about your life, because I just think you're so amazing. But we can now, dive into a little bit of what is acupuncture for kids, and how is it non-invasive, and really what is it, and hopefully you can show us some tools as well.
Yeah, so I feel like the most important thing to begin the conversation along those lines with is letting your parents know that for the child, as soon as the child is old enough to consent, we give them the option. So children have the option of doing acupuncture or not. When the child doesn't have the ability to consent, you can get away with doing acupuncture without a child noticing, which is really beautiful. And in some ways that sounds incredibly like horrific or invasive, but the truth is when you're playing with a child and you're distracting a child, and you put a needle in for approximately half of a second, and the gauge is so small that they don't notice the difference between you sweeping your hand along their arm and you putting the needle in and out. There's really not much invasiveness there at all. Of course, that being said, anytime you do penetrate the skin level, there is a level of invasiveness that we have to consider, but that is why the body responds in the way it does, is because when the body notices it starts to change on a hormonal level, it starts to change the tissues, it starts to change where inflammation is flowing, how the body is perceiving its state of balance. And so I'll just give you a story to explain. People have often asked, like, what age do you feel it's appropriate for a child to receive acupuncture? I think that more important question is, at what age do you feel it's appropriate to ask the child if they will receive acupuncture? So when my daughter was, I believe, 6 weeks old, I gave her first acupuncture treatment. Sometime around a year and a half, she started noticing that I was giving her acupuncture treatments, and I stopped. So in between 6 months and a year and a half, so for about a year, she probably got about 5 acupuncture treatments, not a whole lot, coming from an acupuncturist, but she didn't protest that whole time because I did it quickly. And so let me explain why I gave her first acupuncture treatment. She was waking up every morning with a crusty eye. And so I tried all the tricks that you hear about, including the lacrimal gland massage and the wet compress and the breast milk, and hoping and praying that one day it would just kind of go away, and it wasn't. So I decided to, of course, not put acupuncture needles near her eye because I'm her mother and that sounds horrific. But there's a system of Chinese medicine called tongue acupuncture, Dr. Dong. It's pronounced with a D, even though it looks like T-U-N-G. Mm-hmm. And so basically this is a way to use holographic imaging to treat the body locally, but in a non-local area. So we use the image of the eyes of the knee. The patella creates those 2 little holes underneath sort of the left and right of them. Those are called the eyes of the knee, and putting needles in there treats the eye. And since I've given my daughter that treatment and it was extremely successful, 3 days later, we noticed that she hadn't had any more issues with her eye, and she never did. I've given it to about half a dozen other moms who were so impressed with how miraculously it worked that I gained some new fans. That's kind of a testament to what acupuncture can do. Basically, it's important to remember that when a person is hurting somewhere, they have an issue somewhere, you don't have to put the needle in those areas. And in fact, if it's a child, it's sometimes, most of the time, better if you don't.
Yeah. And then you have a few tools. I can kind of see it popping into the screen.
Oh, yeah. So I have some Shonishin tools, and they all have their own names. So I'll just briefly show you them. This right here, this looks like a big flattened penny that got to be the shape of a whale. And when I use this on a child, I'm using it in a brushing type of movement. And mostly they're feeling my hand, not this. But this is conducting a little bit of energy and sweeping it off the surface. And generally speaking, it's done just in these sweeping strokes. And interestingly enough, this point that's a little bit more like an acupuncture needle is not touching the kid's skin. It's just kind of how it tapers down for my hand to use the tool. Mm-hmm. And this is called a Taishin, and it's probably the most popular non-acupuncture, non-insertive needling device that we use. And again, the sharp tip is not what is used. We use the rounded tip, and we do a lot of tapping techniques. And this is something that moves the qi and disperses the qi a little bit more forcefully. and is a great distraction prior to needling a child. So tapping the skin, you don't even really need to use this to do that. The funny thing about treating kids is I don't need to use needles. I don't need to even use my tools, but I do use my needles and tools because they're a little bit more effective than just using my hands.
Yeah.
So, you know, tapping the area, then the needle in and out, and the child doesn't usually notice. Finally, this I believe is called a chokishin. Sorry, I didn't know the name of the first one, but this isn't my main modality. And again, this is where I hold my hand. This is where I actually kind of make ever so slight contact like this along the skin.
Mm. Yeah. Is there something that, say a parent is really interested in bringing their child in, may not know how they're going to react? Is there something that a parent can do at home with their kids, maybe a specific movement or on a specific part of the body that can maybe kind of allow them to dip their toes and experience or with their children before they come to the clinic?
Depending upon the age of the child, I think that the biggest thing a parent can do is just being there in the treatment room, because the parent is really the healing energetic force. And as long as the parent is there, the child feels safe. And so parents never leave when I treat a child. They're there the whole entire time. And sometimes they do help a lot more than others. For instance, when the child's not old enough to sit up on their own yet, the parent needs to, you know, sometimes be right there to assure the child. As the child is toddler and a little bit beyond, when we try and sweet talk a child into getting acupuncture, and they may have antsy feelings about it, sometimes we can, as a parent, encourage them to talk about going to get a treatment and how they're excited for it, and things like that, just to get kids thinking about it and not be afraid of it. Because, you know, we all make the mistake of using the term needles. Some people prefer to use the word pins. We all think about you know, acupuncture as something that before we've been exposed to it, the needles, they seem really daunting. But as you know from being an acupuncture patient, the actual size of the needles is so small that they're more like the size of a hair.
They are. I sometimes cannot even feel that it's going in.
Right.
And just to transition for both, you know, more into what parents can come in for. And when I say parents, I really just mean anyone. Acupuncture is really open and available to anyone and can help with a myriad of different issues and challenges that you're going through. And I remember seeing you, and we talked about, you know, my third chakra, and, you know, opening that. So maybe you can speak to what it is that acupuncture can help with. And I know some people are interested in some scientific background and some hard evidence, not that we have to go too detailed into that, but if you can speak to the transition and helping parents and anyone really in some scientific background.
Okay, where to start? So usually it's the dudes of the population that are the ones that are like, well, you know, I don't think I'm going to use it because it doesn't sound scientific. Basically, in our country, there's a throwback to using certain vernacular with certain professions. Pseudoscience, acupuncturists, chiropractors, like these things are still listed in some textbooks, local textbooks in Oregon. So to kind of cut through all that, there are provable things that acupuncture does. It vasodilates all of your tissues. So basically you have blood flow flowing through, you know, your body. This is the biggest difference between you, me, and a dead person, right? So we've got blood flow, they don't. When we have diseased tissue, the blood flow is impinged by inflammation slows down the area of blood flow. And so we want better vasodilation so that we can get more blood flow to the disease areas. We all know about hormones. So many females know and respect acupuncture for what it can do with hormones. But beyond just the female hormones, you know, the anti-inflammatories and painkillers and endorphins and beta endorphins are all released. So this is your neuroendocrine system from acupuncture. And they've done hundreds, if not thousands of tests that prove this by drawing blood, you know, before and after giving acupuncture to animals and things like that. So they all get released in the blood, and that's a provable effect. Also, acupuncture can help to create new tissue, which is really important because when you have a disease pathology type of area in your body, the tissue basically new tissue needs to be made. And then finally, we have a nervous system that when it gets inflamed, things don't feel good, and we become, prone to being in constant pain. Well, the proprioceptive and nociceptive pain receptors in your brain, in your body, that do transfer up to your brain, they are inflamed when you're in chronic pain, and acupuncture can de-inflame all these types of nerves in the body, so that can help to reduce chronic pain. So that's for the dudes. Sorry to stereotype. And when you look at that Rubik's Cube of different things that acupuncture is doing, there isn't really anything that acupuncture can't at least help with. If you have a body, you can come up with a reason to get acupuncture. I think because it is sort of this hurdle that once you've had it, you've gotten over the hump and you understand that it can work, a lot less people feel like they have to be, in serious pain or dying to get acupuncture. Yeah. It can just be like going to the spa. But the truth is, in our society, we still have a very reductionist method of looking at medicine. We still believe that, to have an acupuncture treatment, and that this is really not how our country is. This is just how the insurance companies in our country are. You have to have pain, and therefore the pain has to get better, and then your treatment was validated, or therefore they pay me. But realistically, everything that you can possibly come up with for a reason to get your body from one place to another, your mind from one place to another, your thoughts and your feelings even to align with health and with balance. We're all connected, and people forget that. When we're treating someone's shoulder pain, for instance, you know what we're also treating?
What?
Stress. How many times have you heard a person say, "Oh, I just carry all my stress in the shoulders"? Like, I hear it every single day. And the truth is, we do certain things with our body when we're feeling certain ways. So there's a crossover with every different area of the body that you're treating. There are sort of mental, emotional reasons why we might have pain there. And so, it's not like I'm psychoanalyzing every patient that comes in, but you see these patterns over and over and over again enough. And pretty soon a person can come in and just give me emotional symptoms, and I know where in their body they need to get back into balance. Doesn't mean I'm going to needle them there, but you know what I'm saying.
Yeah. And I think it's important to just full circle that we don't have to wait till we're truly in pain to get help or work through that challenge. It can start as young as 6 weeks. It can start throughout your life. You can take your children, you can prepare them to receive acupuncture, whether you're using needles or not. But it's just such an amazing thing in my life, and I only wish that I had received this as a young girl.
Yeah. And then to bring it full circle once again, you were asking earlier about how do I balance sort of like, here's what I could be, and this is where I really am. I feel like it comes back to this idea that every single day of your life is a new day. And so we have to continually make decisions each and every day of our life. We don't just one day realize that this is the perfect diet for us and then we follow it forever. Like, maybe we had a day of great eating, or a week of great eating, or even a month of great eating. Heck, yeah. I was sugar-free for an entire year, and that was a really good year for me. However, life goes on, and we keep on, falling down, and you got to get back up. So that's what it is. It's a practice, and that's what, Chinese medicine can offer people as well, is this lifestyle information. We're not just going to be better in one treatment or give you the magic point that makes everything go away. I mean, sometimes people get better in one treatment, and sometimes there seems to be magic points that make things go away. But, we're on track for a whole adventure that lasts a lifetime. And so, yeah.
Well, I love that. And Is there anything else? You're a wealth of information, and I'm so happy you're in my life, so I can turn to you in moments that I think acupuncture can flourish. And like we talked about, it can really flourish in many different ways, whether it's for the mind, the body, or the spirit. And yeah, thank you so much. Is there anything you would like to let the listeners know, ways to get a hold of you and see you?
Oh, well, gosh, I'm always available for 15-minute consults, and people can just call me up, leave a message. I have to confess, I'm like hit or miss 50-50 with answering my phone. Leave a message. I'll call you back. We can talk about if you're a good fit for my practice or not. If I know someone who would do better at treating your condition, or if I don't think that I could help very much, I'm willing to say that. But some of the ways that I've developed have had everything to do with having a patient with a unique condition that I haven't treated before. And then all of a sudden I'm delving into a lot of studies on it. I want to also mention that in the clinic I work at, we have other acupuncturists, and we have a new osteopathic doctor who's worked for a long time in community health. Her name is Teresa Bear. And she's now working 3 days a week here. And yeah, you can get a massage here as well. And we're in the Ford building, which is on 11th and Southeast Division. And it's pretty hip, cool little spot in here. We've got art installations coming through every month. And I'm right across the hall from Pinterest and some other artists and product makers of really cool sorts.
It's a magical space for sure.
Yep, and you can look us up at wildfirefamilyclinic.com.
Yeah.
And yeah, I'm very accessible. You can bug me by email, telephone, and all that information is online.
Great, and of course I will link everyone to your website, and please, if you are in need or want to figure out or ask questions, Kevi is a beautiful human to help you through that journey. That was the end. So thank you so much. This has been Insight into Wellness, and you can hear more Insight into Wellness at greentreeayurveda.com/insight into wellness. And do you have a topic you're interested in hearing about? Or are you a holistic health leader in your community and you would like to be featured? I would love to speak to you. You can email me at hello@greentreeayurveda.com. Thank you so much, and I will see you all in the